Hi, Dr. Miller. My name is Shiloh Johnson. I'm with EverydayFamily.com. We are a pregnancy and parenting website with over 4 million members. And today I was hoping to talk to you a bit about pediatric dentistry and cavity prevention. I have a 5-year-old daughter myself and a 2-year-old son, and I know that this is an issue. My daughter's actually already been diagnosed or already had a cavity filled once in her life, and I'm hoping to prevent more of them. So I know there's something new and exciting that's kind of been discovered about how we can prevent tooth decay, and I was hoping you could kind of share that with us.
You bet, Shiloh, and thank you so much for having me. I hope this information is going to be good for you and also your viewers and listeners. But one area that's new in the U.S. is utilizing an antibacterial liquid called silver diamine fluoride. Now, Shiloh, this is not a panacea, but I'll kind of describe a little bit about appropriate usages and where we use it in limited situations. Where I use that in my practice is if I have a very young child that has an early cavity, so they're not having any pain or infection resulting from that, but they are really maybe not at the age where they're going to be able to manage or handle the treatment of that tooth at that point. Utilizing this liquid, what it will do is it kills the bacteria to prevent the progression of that cavity or slow down the progression of the cavity. So really what we're looking to do with that is buy time. Buy time until that child's a little older so we can manage that more when that would be more appropriate for the child. I think, Shiloh, the thing that's important to know about that liquid is, in addition, there are some cosmetic effects, and it does turn that spot on the tooth where the cavity was dark or more of a black color. So there will be some cosmetic effects. That can be resolved when that tooth is treated permanently in the future. But that's kind of what's new out in the U.S. today.
Wow, that's really exciting, though, that there's an alternative to having to fill those cavities, especially with the little ones that really can't or don't feel comfortable sitting still for that right now.
Right.
That's awesome. So let me ask you, do you believe there's a gap between parental knowledge about, kids' dental issues and their action? Are parents aware of everything they need to be, and how can we fill that gap, I guess?
You bet, Shiloh. And, indeed there's a gap, and I see that in my patient families here every day. I've been a private practicing pediatric dentist for 30 years, and that gap really exists in, let me just give you an example, Shiloh. I see a family that comes in, they may have a 3-year-old, I diagnose a cavity on that child, and I advise the parent, we should treat that for your child's best oral health. Now, let's say that child is cooperative, and I feel that, hey, we could manage that at this point in time in that child's life. One question that may cross their mind is, well, this is a baby tooth. Does this really need to be treated? And I think it's important to know that baby teeth aren't lost, all of them, until sometimes at middle school. So from the age of 6 to 12 or 13, that child is losing baby teeth. And if this is a tooth that they're not going to lose for many years, then there's a much more significant risk. If that cavity on the baby tooth is left untreated, it will not only cause pain and infection, but now damage and put at risk that permanent tooth. So that's the gap that we're talking about, is understanding, hey, we need to act on that. We need to manage that problem for that child. And we have a lot of variety of ways in pediatric dental offices that we can manage those effectively and comfortably for the child.
That's awesome. Now, what are some of the primary culprits in childhood tooth decay and oral health issues? I mean, obviously sugar.
Yeah.
But what else should we as parents be looking out for to try and prevent this with our kids?
Shiloh, one thing you mentioned to me is your website is mostly with very young moms or expecting moms. And so the one area that we see the higher risk in infants and young children is the pattern of nursing bottle use. And you may have heard of a term called nursing bottle cavities or baby bottle cavities. Essentially what that is a situation where a infant is put to bed at night with a nursing bottle. That bottle has pretty much anything other than water in it, whether that's juice, milk, formula. And the child nurses on that all throughout the night for several hours. So for many hours during the night, their mouth has this warm, sweet liquid. That allows the cavity-causing bacteria to really go really hog wild, for lack of a better description. And that puts that child at much higher risk. So again, we want to encourage moms and parents to feed their child before bed. Try to feed them enough so they sleep for longer periods of time, but try not to put them at night with a bottle other than water.
Mm-hmm. Awesome. Now, what are the dangers of tooth decay in young children? I mean, obviously, you kind of touched on it where, it can damage the underlying permanent tooth. And that's ultimately, our permanent teeth are with us forever, so we got to take care of those baby teeth. But are there any other dangers of tooth decay for young kids?
Shiloh, there are. And as you had mentioned, the baby teeth really form the foundation for the developing permanent teeth. And we're learning more and more every day about the link between good oral health and its effect on our general health, and bad oral health and its effect on general health. What we know, there's a link between oral dental disease and increased problems with diabetes, the link with oral disease and premature labor, the link with oral disease and cardiac disease. So we're learning more and more of the link between our general health and our oral health. So that's really where, the area that you had mentioned, what are we finding that's where it goes beyond just the mouth?
That's awesome. Yeah, I mean, I didn't realize that it stretched that far, but that's really good to know. Obviously, we want to take care of our kids, and a lot of people think they kind of put off the dental visits, and they think it's not a big deal because they're baby teeth. But I'm really glad that we're getting this information out to our members, and that they can help share the word, with their friends and family, and that we can get this information out across the masses. Is there anywhere that we can go, we can send our members to learn more about good oral health for their children?
You bet, Shiloh. I'm going to leave you with two ending thoughts. One is a great website to go to called mychildrensteeth.org, which is the AAPD's website, packed with great information for parents and kids. And the second is beginning what we call age 1 dental visit. By age 1, that child should see a pediatric dentist. And that's where we're able to be very effective at preventing dental disease, having that child grow up with a very positive dental experience and a very much healthier oral lifetime of oral care.
Wonderful, wonderful. Well, thank you so much for chatting with me today and sharing all this information. I'm going to make sure and get it out to our members, and so that we can, really help educate parents and take care of our children's teeth.
Shiloh, thank you so much for having me.
Thank you. Have a great day.
Okay, bye-bye.